These are the lecture notes for part 2 of chapter 6 on the skeletal system. Let me get the slideshow ready. I didn't put a this is basically the second half of the lectures from the skeletal system PowerPoint. So we're going to start with fractures. Starting with fracture naming. I don't know why. I don't know why it did that. Okay, so a fracture is a crack or break in a bone. So that is how we define a fracture in a bone. There are two categories of fractures. There are closed fractures and open fractures. Closed fractures can also be called simple fractures, and open fractures can be called compound fractures. If it's a closed fracture, when the bone breaks, it does not break through the skin, and the only way you can see the fracture is by an x-ray. So there is no break in the skin, and you can only see the fracture through an x-ray image. If it's an open or compound fracture, then the bone breaks and projects through the skin. And this is more dangerous. This type of fracture is more dangerous because obviously it increases the risk of infection, because now you've got an open wound in your skin. Fractures can also be named by the nature of the fracture or the location of the break. As far as repairing fractures, once you have a bone fracture, the first step is that a large blood clot or fracture hematoma forms. And then the cells of the periosteum. The periosteum, remember, is the lining of the outside of the bone, and there is a cellular layer. And the endosteum is the inner lining of the bone tissue. For example, in a long bone, it would be the inner lining of the bone marrow or medullary cavity. So cells of both of these linings, inner and outer linings, migrate into the fracture area. So these are stem cells that migrate into the fracture area. And then a callus forms around the break, and that provides strength. So the area where the break occurs will have a callus, and it will be kind of enlarged. Then the cells that we learned about called osteoblasts. Osteoblasts will begin to replace cartilage with spongy bone. So osteoblasts are the cells, the bone cells that form new bone tissue, and spongy bone is always formed first. And then in step 5, it is replaced by compact bone in areas where compact bones exist, you know, in that bone. And like I say, the break, the callus that forms leaves a thicker spot at the fracture site. Here are some images of the repair of fractures. And you can see in step 1, the hematoma is forming. This is a fracture in the tibia. And then you can see in step, it's not the same as the steps that are listed here, but this would actually be step 3 in the notes. But the callus is forming at the break, and the cells of the periosteum and the endosteum are migrating to the area, and new bone tissue is being formed, and you end up with a thickened area where the fracture occurred. So now we are going to talk about the bones of the appendicular skeleton. So if you remember, that's going to be the pectoral girdle, the pelvic girdle, the the upper limb bones and the lower limb bones. So the pectoral girdle first, it's also called the shoulder girdle, connects the upper limbs to the trunk. So it connects your arms to your trunk area using the bones called the clavicle, which we also call the collarbone, and the scapula, which we also call the shoulder blade. Both of these bones are important for muscle attachment, many different muscle attachment sites. The clavicle is actually technically classified as a long bone. It does have epiphyses and it has a diaphysis, but it is an S-shaped long bone. So it's a bit of an exception to the other long bones of the skeleton. Remember, articulate means joint. So if a bone articulates with another bone, that means that they come together and form a joint. So the clavicle articulates with the manubrium at the sternal end. The manubrium is the upper portion of the sternum or breastplate, and the clavicle articulates with the acromion of the scapula at the acromial end. So here's the acromial end of the clavicle and the sternal end of the clavicle. I was hoping there would be a picture. Well, so of them together. But anyway, the sternal end here articulates with this is the best picture I can see. It articulates it here. I'm just going to blow it up. Well, okay. So this end, the sternal end, if you look at the there we go. I was just trying to make this bigger because I know it's hard to see. All right, so if you look here at the clavicle, the sternal end is connecting to the manubrium, this structure that's kind of underneath the arrow is called the manubrium of the sternum. And then the acromial end is articulating with the acromion of the scapula. And then the scapula is on this page here. So this is the acromion of the scapula. Here's another view of it, and here's another view of it. The other side, the coracoid process of the scapula, well, the other side is called the coracoid process, and then the glenoid cavity is where the humerus, the head of the humerus, articulates with the shoulder blade. Okay, so let's go back to the pen, and I will underline a few structures that I would expect for you to know. Make sure that you know that this bone is the scapula, and make sure you are familiar with the acromion, which is where the clavicle articulates with the scapula, the coracoid process, and the glenoid cavity. The glenoid cavity is where the head of the humerus articulates with the scapula. And here are the notes on all of that, so this should help too. The glenoid cavity articulates with the head of the humerus. Sometimes that is called the glenoid fossa. And together they form the shoulder joint. In fact, the technical name for the shoulder joint is the glenohumeral joint. The coracoid process, which was on the opposite end of the acromion, the opposite side of the acromion, it's on the anterior side, whereas the acromion is on the posterior side. But the coracoid process projects over the glenoid cavity, and then the acromion is the articulation site for the clavicle, and it is in the posterior part or the back of the scapula. Then we have the upper limb. I've been talking about the humerus, the head of the humerus. This is the head of the humerus that articulates with the glenoid cavity. So the humerus extends from the scapula to the elbow, and then the bones in the forearm, because technically the arm, remember, is the upper arm. When you say arm in anatomy, you're referring to the upper arm only, the brachial region or upper arm. The forearm is a separate part, and you specifically have to use the term forearm, and it contains two bones, the radius and the ulna, which we'll look at in a minute. And then we have the carpals, which are the wrist bones. The metacarpals are the bones of the hand, and the phalanges are the bones of the fingers. The key bone markings of the humerus, and you do need to be familiar with some of these, definitely know the head of the humerus, which is the rounded portion that articulates with the scapula to form the shoulder joint. And there is a greater tubercle and a lesser tubercle. Okay, I'm sorry, I got interrupted, so I'm going to start back. The humerus has, just like all bones, has projections and different structures that muscles, tendons, and ligaments attach to, and different areas that articulate with other bones. So the greater tubercle and the lesser tubercle are projections. They're little rounded projections on the head. The greater is on the head, and then the lesser tubercle is on the anterior side of the bone. In other words, the front side of the bone, the side that's facing the front. And then there are the medial and lateral epicondyles. And then I do want you to know these are two condyles that have special names, the trochlea and the capitulum. The trochlea articulates with the ulna of the forearm, and the capitulum articulates with the radius, and these form the hinge joint, the elbow joint. So looking at a picture, this is the radius, and this would be the head of the radius that articulates with the capitulum of the humerus, and then this is the ulna, which articulates with the trochlea, and you can see it's curved in like that. So down here, this part is the trochlea that articulates with the ulna, and then this part is the capitulum, which articulates with the radius. So anyway, they form together, they form the elbow joint, and you can also see the greater and lesser tubercle on the humerus, and you can see the medial and lateral epicondyles. For the radius, I always remember the radius is on the side. It says on the lateral side of the forearm, because when the body is in the anatomical position, the palms face forward. So the thumbs are to the outside, they're to the lateral side. And the radius is always on the side with the thumb, the lateral side, or the same side as the thumb, while the ulna is on the medial side, the side of the little finger or the pinky. Bone markings for the ulna, the olecranon, which we also learned this in as far as Body regions is the point of the elbow.